Hi guys, my name is Dr. Darrell Ong. I work at Dental Designs Clinic in Raffles Place at Eden House. Today, I would like to talk to you guys about the broken front tooth, which is not restorable. So I'm pretty sure, you have friends or even family members, who had the very unfortunate accident of, falling face flat on the ground, or maybe getting hit in the face by, something, and they have their front teeth, broken, and then you go to a dentist, and the dentist tells you, this tooth doesn't look good. Don't think it's restorable or don't think it's fixable, right? And the tooth has to be extracted and a replacement option has to be considered, right? So right here in front of me, I have this, one of these patients of mine who had this, very unfortunate accident. He went on the bicycle cycling trail, and unfortunately, he fell off the bike, fell face flat, and fractured this front tooth. Now, of course, looking at the picture, you would think, hey, well, the tooth is fractured, but there's still a little bit of it left. Couldn't you just, do a filling or do a crown to, well, save the tooth? Well, the problem is this, right? So if you look at where the fracture is, so on the outside, right, there is still structure that's left behind. But on the inside, right inside there, the fracture is actually all the way down into the gum. Now, for me or for your dentist to want to do a crown or to do a filling, essentially we need an adequate amount of the tooth, the original tooth that's left behind, in order for it to hold the crown or the filling, right? So in this case, when almost 3/4 of the tooth is gone, right, a filling really won't work because essentially it's relying just on the glue that holds it there. So something a bit more worthwhile, something a bit more durable will be a crown. But a crown, so the way I describe it is you think of it as a helmet, right? So it's a helmet on top of the tooth, and it stays there and it's glued in there and it's held together by the glue as well as a retention foam. In other words, it grabs the tooth. So it's very much like the helmet in the sense that it grabs and holds onto your head. So no matter how you swing, no matter how you look up or down, it's not going to fall off. Now, in this case, because the fracture has gone all the way down into the gum, there's not much of a tooth that's left to grab. So in essence, how much of a tooth do we need? We need something, say, like, that, all right? And then for the crown, it's going to look something that's going to sit across here. So this is how much the blue portion represents how much of a tooth we actually need, and the orange portion represents, how the crown is going to sit onto the tooth. Now, in this case, very clearly you can see that, there is really not much structure that's left behind, and no matter how we put the crown on, we cannot guarantee that it's going to last long, or we cannot guarantee that it's going to, survive, say, a fishbowl later, during the week, right? So for these kind of cases, because of the fracture being all the way in, we deem this as a tooth which is non-restorable. Then we come to, well, okay, fine. If it's non-restorable, it has to come out. What are the replacement options, right? So very, very broadly speaking, right, the first option is always, a removable partial denture. So if you have, elderly folks, family members, right, they wear this appliance that they take in and take out every single time after they eat and, after they eat or before they eat, right? So that is a removable appliance. Now, the second option would be to do a bridge, so a dental bridge, right? So a bridge joins point A to point B, so this way. So in this case, what we would do is we would make 3 crowns, all right? So the first crown is going to sit, let me just change this color. The first crown is going to sit on this guy over here, and then the second crown is going to sit on here, and then we have a middle one, which is, soldered or rather glued to these 2 crowns in the middle, right? Now, there's nothing wrong with this. In fact, all the scientific studies tell us that a 3-unit bridge, right, or a 3-teeth crown, 3-teeth bridge, actually has a really, really long survival rate. In fact, it will match up to that of a dental implant. However, the point is that doing the crown would involve cutting the neighboring 2 teeth. So especially in this case, if when the neighboring teeth are in pristine condition, right, it would be a little bit of a pity to have to sacrifice all that healthy tooth structure in order to sit the bridge. So this brings me to my third option, which is a dental implant. So a dental implant essentially is something like that, right? What you see in front of your screen. It's a really, really tiny titanium screw that we anchor it into the bone, and it holds the tooth on top, right? So in this case, what we typically would do is, we would remove, pardon me. In this case, typically we would go through all the options with the patient, all right, and explain, okay, listen, this tooth is not restorable. These are your replacement options, A, B, and C, all right? Pros and cons of each option are as such. Now, I wouldn't say the ideal, but, well, the logical thing to do in this kind of case would be to place a dental implant so that we can avoid touching the neighboring 2 teeth, and so that we can keep every tooth individual. We don't need to join them together like what we do in the dental bridge. So assuming the patient is amenable to dental surgery and the patient is okay with a dental implant, usually that is what we would propose as the most ideal option. All right, but again, ideal is may not be ideal for everyone. All right, we live in a practical world. Different people will choose different options for different reasons. Okay, but in this kind of scenarios, usually we say the ideal would be to replace it with a dental implant. So how is the process like, right? So we basically get you in, we apply local anesthesia around the region, basically make the whole area numb. We take out the tooth, and on the spot, we place the dental implant into the socket. And usually for the front tooth, if conditions are right, in other words, if there's adequate amount of bone, the implant goes in and it's nice and stable, on the spot, usually we fit on the tooth as well, because, hey, it's a front tooth. We cannot let you walk around with a missing blank file in the front, right? So we fit the tooth on and allow the healing to take place. So the healing usually takes about anywhere between 8 to 12 weeks, all right, for the bone to actually fuse and mature together with the implant, making it nice and stable. So once it's all nice and stable and firm, then we remove the temporary tooth and replace it with a permanent porcelain one that looks pretty much, I dare say, exactly like the neighboring tooth beside it. So essentially, this is what we normally would do for a broken front tooth that cannot be restored, right? But now, if you find yourself in this kind of situation and you do have this problem, go see your dentist and find out exactly what the options are. And well, for further information of more details later, just tune in to Before and Beyond.